Hi, friend. This is Dr. Apurv Mehra, and I welcome all of you to this talk on the approach of a young budding pediatrician. You join pediatrics and you get it into a college, and you have given an exam, and that rank has decided you enter into which college. And suddenly there's a tag on you, you belong to a central institute, non central institute, and where the difference created by conceptual is that we are getting everybody on a level playing ground. It gives a chance for everybody to learn. It is right of a person or a doctor to learn because a patient is not worried about where your education is from. He's concerned about how well you treat a person. So I welcome Professor Dr. Vinay Aggarwal sir on this talk with me. Welcome, sir.
Thank you very much for inviting. Thank you. My pleasure.
So people know that you are an astute clinician, right? And they dream about becoming something like you. It is first year of post graduation. You've just entered, you're just understanding how it goes. But that is the most enthusiastic year as well. You have lots of dreams. You have gone through MBBS and you have cleared tough entrance exams and you want to get into this specialization. What is your piece of advice for the people not to slip at the early stage in postgraduate training as residency, year one?
I will, advise young budding doctors to remember one thing. The most important thing in life for anybody, including doctors, is that you have to be a good human being. And you have to be a good doctor. Don't worry about this super specialization and specialization. That will come out very easily. But your goodness always resonates on the patients. So learn to empathize with the patient, learn to listen to them, what they are saying. And you will be able to make most of the diagnosis what a illiterate mother or the grandmother tells you. So you learn to listen and learn to be empathetic with them. I think then only you can become a good pediatrician.
The points to take from here is right. आपका कितना बड़ा नाम है इससे मरीज को कोई फ़र्क नहीं पड़ता. पेशेंट को इससे फ़र्क पड़ता है आप उसको कितना टाइम दे रहे हैं. कहते हैं ना जो साथ खड़ा वो सबसे बड़ा. अगर आपके पास पेशेंट आ रहा है द फर्स्ट चांस अ डॉक्टर हैज़ इज़ टू examine a patient while the patient is walking in your chamber. As an orthopedician, that's very important because that's gate for us. In your branch is different. Sometimes the child is carried by the mother, but sometimes the child walks to you. That can tell you a lot of things. And then you need to look at the patient. There are certain facies which can identify certain syndromes. You cannot ignore them, right? And then when you are examining, keep your phone aside. The social media is the biggest obstacle. Imagine, right? You are a patient yourself. When you go to a clinician, you would not like the doctor looking at a phone and talking to you. You have to be 100% focused on it. So, एक मुनि है जिनकी ज़िंदगी 130 साल की है. उनसे पूछा गया कि आप 130 साल तक कैसे ज़िंदा हैं. द आंसर ही गेव वॉज मैं एक बार में एक काम करता हूँ. जब मैं पानी पीता हूँ तो मैं पानी पीता हूँ. एंड दैट इज़ द सीक्रेट टू एनीथिंग यू डू इन लाइफ. योर distractions have to be minimum. Your focus automatically comes there. So the first thing is focus on what you're doing. And he says becoming a good human being. Sir, it is not an easy task to become a good human being.
Very difficult.
But it is also a very tough area because दादी कहती थी that जब आप अच्छा बनोगे ना तो वहाँ पे भी लड़ाई बहुत है. अच्छे लोग भी बहुत मिलेंगे आपको. So कहते नहीं है birds of the same feather flock together. So they are together. That reminds a story, sir, which is about a boy who was taken to a mountain by his dad. And he shouted, "Oh, it's so high." So the voice echoed, "It's so high, it's so high, it's so high." So then the father said, "Speak your name." He said, "Nell, Nell, Nell." He said, the boy looked, he said, "I might fall." They were echoing, "I might fall, I might fall, I might fall." Father said, "I'll be the best." He said, "I'll be the best, I'll be the best." And the father explained, that this is a saying by Henry Ford. If you say you can and if you say you can't, in either case, you'll be the truth. And that boy, with this example, ended up becoming the universal leader of the world. It was Nelson Mandela. So to become a good human being, you have to select the good surroundings. With the good, because you are a mean of 5 people you talk most to in your life. Make sure you have the right kind of people, and 2 of them should be your parents. You will always be balanced. जितना आप अपनी जड़ से दूर होते जाएंगे कट जाएंगे. So make sure you are with your parents. And then, sir, what are the advices? You said empathy. I was talking to one of a very senior professor in one of my talks, and he said, in one of the points, I was very angry with one of the families, and I told my dad about it. And the next day, my dad said, "Go and apologize." But the moment I went to apologize, the family apologized to me. That compassion, that empathy, the feeling of concern, it shows in your eyes. And this branch of ours, medical science, I think it teaches us, it makes us humble, sir, isn't it?
Absolutely. Absolutely. And I think you have to come down to their level. So if a family with the limited resources, let's say come from Bihar, और आप उनसे इंग्लिश में बात कर रहे हैं, या एक पंजाब से फैमिली आती है, try to speak in Punjabi, try to come to their level. They can't come, वो वैसे ही डरे हुए होते हैं. So try to come at their level and try to understand. That is how they will say, ये डॉक्टर साहब तो अपने ही हैं. So that is how you will come to know most of the things about the family and even about the child. They will tell you small things. So
as we are learning, sir, in year 1, right?
That's
as you
correct.
said.
Absolutely. The learning starts from there. I think, most of the pediatrician thinks, learning syndromes or sort of diagnosing a rare case, वो तो सब कुछ हो जाता है. लेकिन आपकी बेसिक स्ट्रॉन्ग्स होनी चाहिए. बेसिक स्ट्रॉन्ग्स ये होना चाहिए कि you can interact with the family. The family thinks that the doctor is kind to them. The rest of the things will come in place on their own. And don't worry about the money, Money will flow. India there is plenty to do, and whatever specialty or super specialty you will do, I think you need to understand that you should be happy. Whatever you get, try to consider yourself that whatever you got it, be contented with that and be happy.
So, Vinay sir, I have a question from you, right? They say that when you see any patient, you must read about it the same day. And if tomorrow there's a case presentation in your ward, come prepared. Your take on this, sir?
Oh,
did you follow this yourself?
Absolutely. I between 11 p.m. to 1:30 a.m., my time is to study. Let me say I don't study every day, but it will be at least 4-5 days in a week. And then, of course, when you prepare for the talk, you have to revise yourself. It may be a simple topic, but then you need to know what is happening around in the world. If you don't don't be a doctor then. Honestly, I will tell you. If you don't have habit of learning, to study, to read medical journals or whatever the information is available, I don't think so you can ever be a good doctor and you can do a good service to your patients.
And sir, just echoing with what you said, I happen to visit one of my teachers every Sunday. I'm very blessed that I have access to his home and I can just walk to any room in his house. And this Sunday when I went to his home, at about 7:30 p.m., he was with a book he was studying. The point is not that he was studying. The point is he's 93. His name is Professor Dr. S.M. Tuli. So at the age of 93, if he can do this, he says, I study every day, Apurv, because I am supposed to be abreasted with what's happening latest, and the education level or awareness level of the patient is going more, and they can ask me anything and I am supposed to answer them. And if I don't know, I'm supposed to read and answer it back when they come to the next time, because that's what the principle of medical science is. You should be willing to learn. And I believe, sir, if your mind doesn't know, your eyes can't see. So you need to have fair idea about things that are happening, sir.
And the other thing is, medical technology is so fastly changing. you need to know what is happening in the other side of the world. You have to keep up to date yourself. Is, whatever practice you do, whether you are even a general practitioner or you are a pediatrician, you will lag behind, and your juniors will take you over. And the most important thing is gives you satisfaction. If you don't keep you up to date, you will keep on writing unnecessarily medicines, perhaps which are not required by the patient, because new research will come that these medicines are perhaps not required, or a new medicine is required. So continuing medical education is, without that, you can't practice good medicine. I'm pretty sure about that.
If you look at the literature, how it says is, medical science almost took 50 years to double its knowledge or literature in the first time. And the next time, the doubling rate was about 9 years. The next time was 3 years. And you know how much time does it take to replicate the print of the literature today? It's about 9 days. That's the speed on which things are evolving. So if you're not studying for 9 days, you're out. Game khatam. So if you are out, it's over. And if you are into practice and you're into private, this is very non-forgiving area.
Yeah.
And that's one thing. So what I understand is clinical examination is a must. Reading every day is a must. Being a good human being, keeping your eyes and mind open is a must. Then comes the second year, sir, second year of residency, when you have to choose your thesis or protocols and you have to work on your research. That's the first time you get an idea about things. And that's the time there has to be a balance between learning the basic examination and the research thing. How to approach that and how you should work upon. I know the guide is there to sail you through, but that's an important aspect of learning in our branch.
People say that, there are not many choices to choose your topic of the thesis or something. But I think you have to be honest with yourself. If you are passionate about, about neurology, or you are passionate about psychiatry, or, you're passionate about nephrology, as I did. So, try to pick up that sort of topic, because then you will excel in that. Until unless you have passion and you have love for the subject, the best will not come out of you. So if you make an effort, pick up a topic, and you will get a topic of your choice.
Fantastic, sir. Now, since you just said that you pick up a topic, you do that, and third year is mainly about exam going approach. And my next question is, I have completed my pediatrics, right? Do I go for a specific fellowship, or I should focus on senior residency? What is your advice?
No, senior residency is a must. I think you learn the maximum during senior residency. There is no replacement of senior residency, because you really get the responsibility. You are the boss at night time in the hospital. And I think that is the time to learn. So I worked in United Kingdom and did nephrology. They would have not taken me in pediatric nephrology if I wouldn't have finished my senior residency. As I said before, you have to be a good pediatrician before you are a good super specialist. So that is important, very important. So senior residency, I will advise everybody to do senior residency whenever they finish post-graduation.
So we can just say it like this, sir. The word senior residency is telling you that it's a part of your residency.
Yep.
The residency word itself tells that it's like a test match, When you start playing the initial balls, they just cross you, zoom करके निकल जाता है. But once you set your eye into that field, फिर आपको वही ball football की तरह दिखती है. And you can hit it anywhere. So you become a better clinician by staying. मतलब टिके रहने से आपको वो ब्रांच समझ आनी शुरू होती है. It's true, sir, the curtains, they'll go out and your picture will become more clear in the branch that you have.
That's
Is that
true.
Correct, sir?
That is true. What my teachers used to say in United Kingdom, UK, if you have done MD or MRCP, does not mean you have become a consultant. You know everything. It simply means you are trainable. So you have to be trained, and the best time of training is when you get the responsibility, and that is senior residency.
Right.
That period will never come to you if you go to super specialty straight away. So you may learn some new techniques and new subject in the super specialty, but I can't imagine you will be a, I don't believe that, if you haven't done a good residency program, you will be a good doctor.
Right. And the last question I have in this talk is, sir, that they say that trying to understand your branch, right, without patience is like trying to read a book and learn swimming. You know, what is the significance of our patients, the biggest teachers we have in our life, in your career, and how a resident should approach towards the patient's examination? Because in today's world, people want to go for shortcuts. They will either go to the, like for this platform, they will just like to see everything online and not themselves touch it. What's your take on examining the patient, learning this art as an important component of your career?
Oh, it is paramount. In pediatrics, you have to learn the practice of listening to the parents because they are the history provider. And you have to pick up the things when the child is entered in the room, whether he's playing, the way he's walking. So until unless no amount of reading books or listening to various talks will get you anywhere. Until unless you have that sort of practical experience, how you talk to the parents and what sort of words you use, you have to be very careful. And that only comes if you are exposed and you have exposed to different strata of the people. In India, there are people with very limited resources, and there are people really who are filthy rich. And, we get all sorts of strata in India. So, and that you will be exposed only if you do the clinical practice, see the patients. No shortcuts.
Today's world is very worried about how to place themselves and market themselves to get more patients, right? And they use social medias for it. They will have different ways to do it. But I can tell you one thing that you don't realize: when a patient is there in your chamber, and if you pay full focus on the patient and his examination, on the history, and then you have a diagnosis and you explain your own prescription to them, your plan for them, and you're honest with your patients, that is your best marketing. पेशेंट को लेके आता है. आप अगर इस बात की इम्पोर्टेंस को आज नहीं मान रहे, you will spend 30 years and finally agree to a statement. You will see, you will be shocked कि आपके treated patient, बट अगर आपने उसके साथ बिहेव अच्छा किया हुआ है, वो और मरीज लेके आएंगे. रिजल्ट इररिस्पेक्टिव है. You all understand in medical science, nobody has ever had 100% result. But effort is appreciated by person, either he is rich or he is not. And मैं तो हमेशा कहता हूँ, आपके पास अगर एक ड्राइवर आ रहा है, आप उसको भी उतना ही ध्यान से देखिए, उतनी जान लगाइए. आपके पास कोई मंत्री आ रहा है, आप उस पर भी उतना ही ध्यान लगाइए. भैया ड्राइवर भी तो मंत्री का हो सकता है, और मंत्री के घर में भी तो लोग हो सकते हैं. सो इट्स ऑल कनेक्टेड. फाइनली आपने कैसे बीमारी को पकड़ा, and how you are able to handle that, and how you are able to counsel, that is what will define you. And it will all boil down to understanding the basic. The communication is the key to success in medical science. True that, sir?
Absolutely. Absolutely. Communication is the most important. And even going to social medias and advertisements and all may get you in the short term more patients, but not in the long terms. You are absolutely right. Your work will speak for itself. The patient will send patients, and word of mouth is the best advertisement. So that is absolutely true.
So thank you very much, sir, for this wonderful insight. I believe that there are a lot of good points you have to take from here. Number one, listen to the parents carefully. Number two, examine the child. Number three, 5 days a week out of 7, he studies from 11 to 1:30 with a roaring practice that he has, heading one unit of the corporate hospital along with his clinic every evening. At this age, he has been doing it, right? And कहते हैं कि most important thing that he has in his mind is sometimes even on Sunday he's seeing the patients. In the morning, he starts with the intensive care. Priority is very, very important in life. And this is what a resident has to understand. He has to learn from everybody that he comes across. जो भी आपसे सीनियर है, जो भी आपके आसपास है, वो आपको सिखाएगा ज़रूर. I will like to finish it with what he just said. India is a world of diversity. You will have on the same day a very poor patient and a very rich patient if money is a criteria. This is what Abraham Lincoln said. His father was a cobbler. And he said, I learned from my dad that he could make the best shoes in the city. He was never ashamed of it because he said, I would make the best shoe, doesn't matter if I'm a cobbler. And Abraham Lincoln will always advertise this, always said that whatever you are doing, wherever you are, आपका नाम, आपका काम, आपके काम से आपका नाम पहचाना जाएगा. Thank you very much.
Thank you. Thank
Thank
you
you,
very
sir.
much.
Thank you,
Thank
sir.
you.